Hi, and welcome to the Ask Dr. Angela podcast with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been too embarrassed or shy to ask your own doctor about your, girl parts? Well, you've come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. Obstetrics and gynecology? She keeps it real. Pregnancy? She's been there, done that. Menopause? She'll get you through. Young or old, Dr. Angela's got you covered, girl. Now here's Dr. Angela.
What's good, people? This is Dr. Angela, everyone's favorite OBGYN, and I would like to officially welcome you to episode 176 of the Ask Dr. Angela podcast. I'm interested to hear from you all. What are some of the holiday traditions that you and your family participate in over the holiday season? A couple of traditions for me and my family are we typically go to church on Christmas Eve. I was really happy when my dad changed that from actual Christmas Day service. I mean, it kind of sucked when you're trying to, focus on the Thanksgiving message, but all you can think about is opening up your gifts under the tree. So that was a really good move on my pop's part. We always put the trees up together. Every year, we each buy each other an ornament. My little girl actually has gotten to the point where she requires her own tree because she's acquired so many ornaments over the years. We always go and see the Rockettes in New York City. Those are just a few of the traditions that we have. And something that we started doing a couple of years ago is every year on Christmas Eve, my little girl, my wife and I go through all of her toys and games that she hasn't even touched over the course of the year, and we put them in this special bag, and we give those toys to children that are less fortunate, not only because of the importance of developing a spirit of giving, but it also happens to make room for her new toys and whatever else it is that Santa's going to be bringing her this year. Let's jump right into today's question. This question comes to me from my friends, once again, at Self Magazine, and this is what they asked me. What are some things women should keep in mind when trying to get pregnant later in life? And my response was the following. You shouldn't wait too long to get help if pregnancy isn't happening spontaneously. And of course, my general rule of thumb for patients that are 35 and older is this. If it hasn't happened within 6 months of trying, see a specialist, specifically an REI physician. That stands for reproductive endocrinology and infertility. Whenever you're over the age of 35, time is not on your side. The other thing to keep in mind for my older moms are certain risks that are going to be increased for the fetus. Things like premature birth and all of the issues that are associated with that. Increased risk of chromosomal abnormalities. Down syndrome is probably the most common example. Low birth weight, etc., etc. The other thing to keep in mind for those women that are delaying pregnancy is that a woman is only born with a finite number of eggs, a certain number of eggs. So certainly as we get older, the amount and the quality of our eggs diminishes. Fertility rates start to decline at about the age of 30, more at the age of 35, and even more so at the age of 40. So even with all of the advances in medicine, things such as IVF are less successful as a woman ages. That was a really great question, actually. The people at Self Magazine always reach out to me, and I'm so appreciative of that. I'm actually going to send you guys some t-shirts. I promise to send everyone a t-shirt that submits a question for the podcast. This one wasn't specifically for the podcast. This was actually for an online article that they recently published. But a lot of those questions I like to use for the podcast because for those of you that don't read Self Magazine, it's really good information to know. So thank you so much, self.com, for always reaching out. And thank you all for listening. Hopefully you all got something out of it. Thank you again so much for reaching out and for listening to the Ask Dr. Angela podcast. If you have a question that you would like featured in the podcast, you know how to reach me. Go to www.askdrangela.com. That's ASKDRANGELA.com. That site has recently undergone and is recently undergoing a lot of work, but it gives you easier access to me. You can click on any of my social media channels and direct message me. That's going to be on Instagram, Twitter, or Facebook. You can also click on the big question mark and submit a question via email. If I happen to use your question on the podcast, I will reach out to you and send you one of my bomb-ass t-shirts. And they're pretty bomb-ass. In closing, I'd like to leave you with this suggestion. Don't major in minor things. In other words, don't sweat the small stuff. Until next time, look better, feel better, be better. Can't wait to reconnect on episode 177 of the Ask Dr. Angela podcast.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon! All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any disease or illness and does not and should not replace treatment from a medical professional. Listening to and participating in this podcast does not create a doctor-patient relationship between you and Dr. Angela Jones. If you need medical advice or assistance, you should consult a physician. Listening to and participating in this podcast is subject to the terms and conditions posted at askdrangela.com/terms.